We count down the days to graduation, we stress over the next exam, and we map out our future down to the very last detail. Completely unaware of how fragile our routines truly are, because the most life-altering moments never show up on the schedule.
Kamusta naman yung baby mo? Okay naman. Ilang buwan na ba yan? 5 months. Alam niyo na yung gender? Oo, lalaki. Ninang ko Bati! Morning, ma'am! Sabihan mo. Oo. Pag-lagi mo ba ngayon? Doon na sa GE. Saan ka magla-lunch mamaya? Sa kantin, ikaw. Sabi nila may bagong bukas na GE. Doon na lang try natin. Nag-crave din ako sa bagong pagkain.
Bigyan mo na ako ng tsaka kalambit.
Teka, tapos na ba kayo sa demo? Ikaw, pre, tapos ka na sa demo? Oo. Ano? Demo?
A split second is all it takes to change everything. One moment, you're focused on your tasks, your friends, your immediate plans.
Grabe, nakakapagod. Buti ka pa, tapos ka na sa demo.
And the next, you are forced to react.
Ano yung dala niyo sa bag niyo?
Ay, kompleto yung ako, David.
Okay naman.
Nawawala nga yung addiction sir ko eh. Ginawa mo ba?
Hiram ka na lang.
When the world suddenly shifts, what will you do? When the ground shifts, you only have 4 seconds to react.
Nabilin doon lang. Lock overhold.
Sarah, kumalma ka nga. Antayin lang natin ito eh. Mapag-threads kayo dyan?
Meron akong color coding dito.
Ano, tara?
Ganito na lang. Kayong tatlo sa may left. Sa right kami ni Rodrigo.
Sige.
Ito ang safe area natin. Sige,
Doon tayo magkita-kita.
Tara din, Sarah.
To save the most lives, Star Triage rapidly sorts victims using color-coded ribbons based on the severity.
Narito po tayo ngayon sa isang state university kung saan nagdulot na maging pagkatakot pagkasira ang malakas na lindol kaninang umaga. Ngayon ay kasama natin si Dr. Kathleen upang matlaman kung ilan ang casualties.
Sa ngayon, ang latest update sa atin, meron na tayong 4 na casualties while meron tayong 40 plus na sugatan. Ongoing pa rin naman yung mga pag-rescue sa mga biktima dito sa school.
Marami pong estudyante ang nakaranas ng matinding distress habang ilan naman ay nagtamo ng mga sugat at pinsala matapos magpanik at gumuho ang ilang bahagi ng mga gusali. Because the painful truth is, in a disaster, safety is never guaranteed. Not everyone will make it out unhurt, and some will not survive.
Laceration is a tear or cut in the skin and underlying tissue caused by blunt force or sharp objects. Unlike a clean surgical incision, a laceration usually has jagged, irregular edges and can vary from a superficial skin split to a deep wound that damages muscles, tendons, nerves, or blood vessels.
Mamukay ka lang. Andun yung iba. Tanggalin natin ito, Ruth.
Ensure safety. Check that the area is stable and free of debris before treating the person.
Ma'am, wait lang po. Hinga ng malalim. Mabubutin namin. 1, 2, 3. Ma'am, kalma lang po.
Control bleeding by applying firm direct pressure with the cleanest clothes for 10 minutes, adding more on top if needed, and elevating the limb if possible. If bleeding persists in a deep wound, pack it snugly from the bottom with sterile or the cleanest gauze. Cover with a pressure bandage and don't remove the packing. Mark the time, watch for worsening pain, swelling, foul smell, or loss of sensation, and get the person to a hospital ASAP, since packing is only a temporary measure until surgical care.
Yung rescuer. Dok, sobra pong dami ko eh.
Titingnan lang, mama.
A doctor assesses a laceration first to check its depth, contamination, and damage to nerve vessel or tendons, and to see if foreign material is present. This decides if it's safe to stitch, what method to use, and reduce the risk of infection, poor healing, or missed injuries.
Ma'am, medyo malalim po ang sugat niyo. Rescuer po ako. May consent po ba na pwede ko pong tahiin?
Consent is needed before stitching a laceration, and an awake patient to respect the right to control their own body and ensure they understand the risk, benefit, and alternatives. Without it, the procedure can be considered assault, even if medically appropriate, and getting consent protects both patient and the provider legally.
Sige po, Dok.
Sir, dito. Lipat natin siya sa open field. Baka kasi may aftershock pa. Pwede siyang mahulugan. Sakit! Aray ko!
Field stitching after an earthquake is only last resort for simple, clean, non-deep lacerations that won't close with pressure. Avoid hands, face, joints, deep or old wounds. If needed, clean the wound. Use boiled or sterile tool and suture. Control bleeding first, then close edges with loose interrupted sutures and cover with clean dressing. Watch closely for infection. Check tetanus status and evacuate for proper care as soon as possible.
Sige nga pre, madambitin ka nga pre. Try mo lang. Sige.
Bigyan mo na ako ng ano, tsaka kalambitin mo.
Go na. Lahan. Ano nangyari sa'yo? Ano nangyari sa'yo? Tulong!
A dislocation occurs when a bone is forced out of its normal position within a joint, often due to trauma, fall, or sport injuries, leading to pain, swelling, and limited mobility. On the other hand, a fracture refers to a break or a crack in a bone, which can range from a small hairline crack to a complete break, often caused by injury, osteoporosis, or repetitive stress. Both conditions typically require medical attention to ensure proper healing and prevent further complications.
Tulungan nyo kami! Tulungan nyo kami!
Possible dislocation. Igat ay immobilize. Hawakan mo. Aray!
Immobilizing a fracture or dislocation as first aid before reaching the hospital is important because it prevents the injury from getting worse during movement or transport. Keeping the bone or joint still reduces further tearing of muscles, nerves, and blood vessels, lowering the risk of broken ends shifting or the joint re-dislocating, and help control pain, swelling, and bleeding, which also lowers the chance of shocks and makes the eventual treatment in the hospital safer and easier.
Bro, relax ka lang bro. Kung may gagalaw to.
Bamboo planks keep the limb rigid so it cannot move and cause more damage, and handkerchiefs tie it securely while cushioning the skin, making it quick, effective makeshift play when proper supplies aren't available.
Dahan-dahan lang.
Di natin ito stabilize, bro. Kasi, possible fracture kasi itong kamay mo.
After an earthquake, first make sure the area is safe from falling debris. Then avoid trying to force the dislocated joint back in. Instead, immobilize it using whatever is available like bamboo, wood, or rolled clothing tied with cloth or belt. Check the fingers or toes below the injuries if it still have normal color, warmth, and sensation. Keep the person calm and covered to prevent shock, and get them to medical help as quickly as possible since professional care is needed to reduce the pain or the joint safely, and check the hidden fractures.
A strong earthquake suddenly struck the community.
Tara, mag-lunch na tayo.
People started running outside because of fear, while others panicked and cried loudly for help. During disasters, fear, shock, and anxiety can overwhelm people. Because of the intense stress, some individuals may begin to experience hyperventilation. Hyperventilation commonly occurs when a person experiences extreme fear, panic, anxiety, or stress during or after a disaster such as an earthquake. The patient breathes very rapidly and deeply, causing decreased carbon dioxide levels in the blood, which may lead to dizziness, tingling, chest tightness, and difficulty breathing.
Ma'am, tumingin ka sa akin. Hinga ng malalim. Conscious naman ng pasyente. May tumama po ba sa kanya, ma'am? Wala. Basta nahihirapan lang siyang huminga. Exhale.
During or after an earthquake, the main priority is ensuring safety by moving to a secure area away from falling debris, unstable structures, and other hazards. Once the environment is safe, assessment of the victim should be done by checking airway, breathing, circulation, level of consciousness, and vital signs if possible.
Isa! May tulungan mo yung kaibigan ko!
Along with guiding them to slow their breathing by inhaling through the nose and exhaling slowly through the mouth to restore normal breathing patterns. Emotional support should be provided to reduce fear and panic, while maintaining a calm environment to prevent worsening of the symptoms.
Dahan-dahan lang po. Sige ma'am, dahan-dahan lang paghinga. Inhale.
If there is minor injuries such as cuts, bruises, and sprains, should be given basic first aid like cleaning wounds, applying dressings, controlling bleeding, and immobilizing injured areas. The patient should be reassured, monitored for changes, and referred for further care if needed.
Dahan-dahan lang paghinga po.
The green ribbon indicates walking wounded with minor non-life-threatening injuries. These patients are stable, able to walk, and can safely wait for treatment, while priority is given to more critical cases.
Ito, brown bag. Teka ma'am, hawakan mo siya na mabuti. Huwag mo siyang hayaan matumba. Dito ma'am, huminga ka dito ng
Allowing the patient to breathe exhaled air to increase carbon dioxide levels and reduce symptoms like dizziness and tingling.
dahan-dahan. Tama lang po yung ginagawa niyo, ma'am. Okay na ako. Salamat. Sige po. Thank you, miss. Sige po.
Ano, kaya pa ba? Ano, leader? Tawag na ako ng rescue.
Nagpansit kasi si Ruth eh.
Evacuation must be swift and safe. By utilizing the walking assist for minor casualties, a single rescuer can stabilize the patient, clearing the path for critical rescues while guiding them safely toward further care.
Aray! Relax ka lang. Ay, ko.
Ano nangyari sa'yo?
Nabali ako. Ay, ko.
When a victim cannot walk, a two-man carry is the safest way to move them. Sharing the weight between two rescuers prevents back strain, keeps the patient steady, and allows for much faster evacuation through narrow doorways and hallways.
Aray! Tulong. Sige po, kalma lang po kayo dyan. Sir! Need po siya ng transport.
Bakit? Ano nangyari sa pasyente? Ma'am?
Sige na
Wait
po.
lang kasi
Kalma ka
bigyan
lang
tayo
po.
ng pwedeng pang-transport. Ay.
When a victim is unconscious or too weak to walk, the blanket drag allows a single rescuer to move a heavy patient quickly. By pulling the blanket along the floor, it protects the patient's spine, reduces physical lifting strain, and allows for a rapid escape from immediate danger. For victims with severe or unknown spinal injuries, stretcher transport is the gold standard for safety. It keeps the patient's body completely flat and immobilized, preventing further nerve damage while allowing multiple rescuers to move them over long distances with maximum control and comfort.
Oh, ano nangyari sa'yo?
Lumilindol ba, pre?
Ha?
Nanaginip ako eh.
Hindi.
Totoo nga. Ang daming casualties dito.
Panaginip mo lang yan, pre.
Totoo, Brams. Sabi sa'yo eh.
Takot ka ba, Elfon?
Behind the scenes.
Dapat marami tayong biyan.
Okay pa naman, buddy.
Paano yun natin? Kapit tayo. Montage naman. Ito ang dinadito nito. Dahan nyo dito. Nalilindol o tatumba-tumba kayo.